Hi everyone, so today we'll be covering infection control and prevention with a strong focus on Irish guidelines and important points you need to know for the Irish Dental Council exam. So infection control is a higher topic in the Irish Dental Council exam. You could get questions in the society paper or also in the disease paper. So to reduce the risk of cross-contamination and infection, we must practice standard precautions on all patients. So we have to treat all patients as if they carry an infectious disease. To practice standard precautions, which are the minimum set of infection control measures, we have to perform hand hygiene, respiratory hygiene, wear appropriate PPE, safely dispose our sharps, disinfect and sterilize our reusable equipment appropriately, environmental cleaning, appropriately handle our waste. We have transmission-based precautions, which are extra measures we have to practice when we know a patient is infected with a certain virus or bacteria. So it depends on the mode of transmission. So viruses or bacteria that are transmitted by contact, such as the MRSA or the C. difficile, we have to make sure we're wearing gloves and an apron. For viruses or bacteria that are transmitted by droplets, such as the seasonal influenza or the mumps virus, we have to make sure we're wearing a surgical mask, eye and face protection. For viruses or bacteria that are transmitted by airborne transmission, such as the tuberculosis or the chickenpox or measles, we have to make sure we're wearing a respirator mask, such as the N95. In the dental setting, it's best to just defer treatment and only treat urgent cases. Just wanted to explain the difference between droplet and airborne transmission. So a droplet is a larger size. So because it's a larger size droplet, so it's more than 5 micrometer, it will travel a short range and it will fall quickly onto surfaces. So an example is the influenza virus. So they will be transmitted by coughing or sneezing. Airborne transmission is when the air particle or the aerosol is small in size, so it's smaller than 5 micrometers, so it travels a long range because it's smaller, and it remains suspended in air, and it can travel also with ventilation or with air currents. So TB is an example of this. Hand hygiene is actually the most effective infection control measure. Alcohol-based hand rubs should be used only when hands are visibly clean. You can reserve washing your hands with soap and water to when your hands are visibly dirty. After coming in contact with a patient suspected to be infected with a spore-forming organism like a C. difficile or a gastroenteritis virus, after using the bathroom and before eating or preparing your food. The World Health Organization published 5 moments of key hand hygiene, so these are important to know for the exam. So the key moments are before touching a patient, before an aseptic procedure, after body fluid exposure, after touching the patient, and after touching the patient's surroundings. So we'll move on to PPE or personal protective equipment. So PPE is mandatory in dental practices and it includes gloves, surgical face masks, protective eyewear with side protection, and gowns or aprons when required. So the non-latex gloves are preferred according to the HSE guidelines. The masks must be changed between patients, so not at the end of the day, and the PPE must be donned and removed in a specific sequence. So when putting on your PPE, you have to perform hand hygiene. You'll wear your gown, you'll wear your mask, your eyewear, and then the last thing is your gloves. When removing your PPE, so you remove the most contaminated thing, which is your gloves, and then you perform hand hygiene. You remove the rest of the PPE, and then you perform hand hygiene again. So we'll just go over some regulatory bodies that are responsible for healthcare regulation in Ireland. We have the Health Information and Quality Authority, which are responsible for medical ionizing radiation, and they focus on patient safety. They are also responsible in implementing infection control programs in healthcare facilities in Ireland. We have the Environmental Protection Agency, which are responsible for the licensing of X-ray equipment, and so they focus on public and environmental safety. We have the Irish Dental Council that posts professional codes of conduct for dentists to follow. The Health and Safety Authority are responsible for workplace safety, so they focus on occupational health of staff. We have the HSE, which is the equivalent of the NHS in the UK, so they are the public health service providers in Ireland. They, in collaboration with the Health Protection Surveillance Centre, publish clinical guidelines. So in addition to publishing guidelines, the Health Protection Surveillance Centre is also responsible for surveillance and control of diseases. So we'll move on to occupational health. It's mandatory for at-risk staff to be vaccinated against hepatitis B. There is no vaccine for hepatitis C, and it's recommended for everyone to be vaccinated against the influenza virus. And because viruses like the TB, the measles, the mumps, and rubella can be acquired occupationally, the staff member must know their immune status in relation to these diseases. Dentists can come in contact with hepatitis B, C, or HIV when the patient is a carrier of these viruses and a sharp injury occurs, or when a mucosal splash injury occurs, so when the blood comes in contact with the mucous membranes of the eye or mouth. So it's very important to practice sharp safety, so never recap a needle, never break or bend a needle, avoid passing needles to staff, and dispose the needle as soon as you're done with it. And when the sharps container is 3/4 full, make sure you arrange for its collection. In the incident of a sharp injury, encourage the bleeding under running water and wash your finger with soap and water. Make sure you don't squeeze or suck the wound and cover the area with a waterproof dressing. In the case of mucosal splash injury, make sure you wash the affected area with a copious amount of water. If you're wearing lenses, make sure to wash before and after removing the lenses. So after the initial management of the sharps or mucosal injury, you have to document the incident, report it to your manager, and you have to determine if you need post-exposure prophylaxis. So the Health Protection Surveillance Center have posted guidelines on the emergency management of injuries and post-exposure prophylaxis. The need of prophylaxis depends upon the type of exposure, so if it was a significant or an insignificant type of exposure. It will also depend on the host's vaccination status in case of a hepatitis B exposure, and the source's viral load, and if they are on antiviral therapy or not. So the need of prophylaxis needs to be determined right away, because for hepatitis B, the prophylaxis needs to be given within 48 hours, and for HIV, it needs to be given within 1 to 4 hours, and there's no prophylaxis for hepatitis C. Infected dental healthcare workers are ethically responsible to seek medical advice if they believe they are infected, so they should get tested and they should be under the care of a consultant. They should always be aware of their health status and they should always observe infection control. So we'll just go over zoning and environmental cleaning. So the clinic should be divided into clean and contaminated areas. So the area around the patient, around 1 square meter, should be considered contaminated, and so this should be cleaned between each patient. The area outside of the contaminated area should be cleaned frequently with the appropriate disinfectant. Surface barriers should always be used, especially on equipment that are difficult to disinfect and sterilize and are used intraorally. So for example, the intraoral camera or the X-ray sensor or the light cure. Always try to use Jaberdam for restorative procedures and endodontic treatment, because this reduces contamination of the tooth, as well as it reduces splatter and aerosol generation. All dental practices should have a local decontamination area, so it's a designated area where the staff can decontaminate the instruments, so this should be as far as possible away from the patients. New practices are required to have a local decontamination unit, so that's a separate room where they perform their sterilization and cleaning of instruments, and it should be fitted for a washer disinfector. Management of blood and body fluid is another essential component of infection control. So the person dealing with the spill should wear the appropriate PPE, should wipe the material with an absorbent material and dispose it. The area then is cleaned with a detergent, and then it's wiped with sodium hypochlorite. So the concentration of sodium hypochlorite depends upon the amount of body fluid or blood. So 1% sodium hypochlorite is used for large volumes of blood, and the 0.1% sodium hypochlorite is used for spot splashes or small volumes of blood, urine, or vomit or feces. So just go over some terms together. So cleaning is the process of physically removing debris and microorganisms. Disinfection is the process of eliminating many or all pathogenic microorganisms on inanimate objects, with the exception of bacterial spores. Sterilization is the process of destroying all microorganisms, including spores, and is an absolute condition. So the instrument or tool can be sterile or not. Instrument decontamination is a 5-step process. So the instruments are transported in sealed, labeled containers to the local decontamination unit or room. And if unable to sterilize within 30 minutes, it's best to keep the instruments moist, because this prevents drying of blood and proteins, which will make cleaning and disinfection more difficult. Next, we have the cleaning stage. So the best practice for cleaning is using a washer disinfector, because this eliminates sharp injuries to staff. So the washer disinfector looks like a dishwasher. So you'll place the instruments, including the handpieces. So the handpieces will have a specific adapter which will allow the solution or water to enter and clean the lumen of the handpiece. The second best option is using an ultrasonic cleaner. So if you have a look at the image on the bottom left, so you'll place the instruments and run a cycle. So this still poses a sharps risk to the staff. However, it's less risky than manual cleaning, because you don't have to do as much scrubbing of the instruments. And the third best option is manual cleaning, because of course the sharps risk. So the person manually cleaning the instruments should be wearing heavy-duty gloves and appropriate PPE. Always make sure the washer disinfector and ultrasonic are cleaned appropriately and according to manufacturer's instructions, and make sure you service them. So we'll go over handpiece cleaning because it's been asked in the exam previously. So handpieces can be cleaned in a washer disinfector, however it can't be put in an ultrasonic bath. If you don't have a washer disinfector, you can just wipe the outside of the instrument with a disinfectant wipe, and then after you clean the instrument, you oil it and you can place it in the autoclave. After cleaning, inspect under magnification and light. Package the instruments into autoclave bags and label the bags with a date and cycle number. After that, the instruments can be placed in an autoclave. So the most commonly used autoclave in dental settings is the Class B autoclave because it can sterilize all types of load. So the minimum temperature is 134 degrees Celsius for a minimum of 3 minutes and a pressure of 2.3 gauge. And always make sure to use distilled water in your autoclave because tap water has a lot of minerals which could damage the autoclave because of the mineral precipitation. After the sterilization cycle is complete, make sure the instruments are dry and you can store them then in a clean, dry location, and you can store them for up to 12 months. It's very important to check the safety and function of the autoclave. So daily checks include checking for door seals and locks and a steam penetration test. So using either the Helix test or the Bowie and Dick test. A vacuum test must be done weekly on a cold, empty autoclave on the first day of the week, and the autoclave has to be serviced annually by a professional person. All test records and servicing records should be kept for 8 years. So we'll just go over some bacteria that can be transmitted in the dental office. So we have the Staphylococcus aureus, which can cause skin and soft tissue infection. We have the Streptococcus pyogenes, which can cause throat and skin infection. We have the E. coli and Klebsiella pneumonia, which are enteric bacteria. We have bacteria that can thrive in water lines, so the Pseudomonas aeruginosa and the Legionella pneumophilia. So because these bacteria thrive in water lines, they can be spread by aerosol generation while using the handpieces or the ultrasonic scaler. Legionella pneumophilia is a gram-negative aerobic bacillus. It causes Legionnaire's disease, which is an atypical type of pneumonia. Pseudomonas aeruginosa is a gram-negative aerobic rod-shaped bacillus. It causes local infections such as abscesses and otitis, and can cause also systemic infections like pneumonia and sepsis, especially in immune-compromised patients. Dental units have dental water lines that supply the high-speed handpieces, the air and water syringe, the ultrasonic scalers, the patient's cup filler, and the cuspidor bowl rinse. Bacteria multiply and form biofilms in these water lines because the stagnant water is warm and the tubes are narrow. As a result, the water passing through these water lines will be contaminated with Legionella and Pseudomonas, so the patient will swallow this water and the aerosols generated will also be inhaled by the patient and staff. The patients at risk are the immune-compromised and the elderly, and so that's why the dental unit water output should match drinking water standards set by the EU, which is 100 colony-forming units per mil of aerobic heterotrophic bacteria in the water. It's important to note that once the biofilms start to form, they become very difficult to remove, and so that's why it's very important to reduce the number of microorganisms in the dental water lines. In order to reduce the amount of microorganisms in water lines, the staff must regularly disinfect the water lines using continuous or intermittent biocides. So continuous biocides can come in the form of a liquid or a tablet, and you can place it in the dental chair bottle, and they can be used while you're working on patients, so they are safe to use. The intermittent biocides, for example, can be used at the end of the day, and you can disinfect the water lines in this way. It's recommended also to flush the water lines for 1 minute at the start and end of the day, and flush for 15 to 30 seconds between patients to remove any stagnant water. It's also important to shock water lines after periods of inactivity. So shocking means using a high level of disinfectant, and always make sure to disconnect unused water lines. Testing the water is very important to make sure the water is safe. So every 6 months, an aerobic heterotrophic bacterial count should be done. So the aim is for the bacterial count to be less than 100 colony-forming units per mil. And a Pseudomonas aeruginosa test should be done also 6 monthly. And annually, a Legionella bacteria testing should be done. And the same, the amount of bacteria should be less than 100 colony-forming units per liter. Cleaning of the bottle is very important and should be done on a weekly basis on the last scheduled visit of the week. So you can clean the bottle with a non-foaming detergent and make sure you rinse it out with water. You can use a brush as well to clean the neck. There are some chemicals available commercially to also clean the bottles. Also, make sure that you fill the water used for patients with sterile or distilled water and not tap water, and you can add the biocide as mentioned in the previous slide. The reason why distilled water is used is because it has less minerals and also because it's formed by heating and condensation, so it has less microorganisms. The water distiller should also be kept clean, so clean it according to manufacturer's instructions. Make sure you rinse the bottle and distiller well. Make sure that you store the distilled water appropriately, so cover the bottle and you can store it in the fridge. Reverse osmosis is another method of purifying water and is used in dental offices. So make sure you clean the reverse osmosis unit and you change the membranes according to the manufacturer's instructions. Always check for the water quality, and you can also run the reverse osmosis water for 20 seconds before using the water at the beginning of the day, and make sure that it's serviced. Appropriate waste segregation and disposal is very important in infection control practices. We have non-risk waste, which is not hazardous and can be disposed in the usual domestic waste disposal system. And we have high-risk waste. So this waste is potentially hazardous to anyone who comes in contact with it. So it can be infectious, biological, chemical, or radioactive waste. And also sharps waste. Infectious waste is waste that has been contaminated with the patient's blood and saliva, and this must be disposed in yellow bags. So anything like the gloves or the mask or the cotton rolls, saliva ejectors should all be disposed in the yellow bag. This bag must be sealed appropriately and should be collected by a registered waste disposal company. Sharps should be disposed of in a yellow, puncture-resistant, leak-proof container. So sharps could be needles, endodontic files, burrs, blades, and matrix bands. Once the container has reached its designated capacity, it must be sealed and collected by a licensed biomedical waste carrier for disposal. Amalgam waste is hazardous and must be collected and disposed of appropriately. So amalgam capsules, amalgam sludge, and used amalgam filters from separation units should be stored in a UN-approved labeled container with vapor suppressant. Extracted teeth with amalgam filling should be treated as mercury-containing waste and should be disposed of accordingly. It's very important for dental chairs to have an amalgam separation unit to avoid amalgam entering the public sewer system and causing environmental pollution. All waste transfer documentation should be kept for at least 8 years. So the waste documentation for amalgam or the sharps or the medical waste. EU has introduced a regulation called the Minamata Convention on Mercury. So the aim is to reduce the amount of mercury in the environment because mercury is an environmental contaminant. So the use of amalgam except when necessary has been prohibited in 2025, as well as exporting it. And the import and manufacture of amalgam has been prohibited in January 2026. This regulation applies to all patients with very strict restrictions on using amalgam on deciduous teeth of children less than 15 years of age and pregnant and breastfeeding women. Disinfection of impressions is very important to prevent cross-contamination between the dental office and dental labs. So all impressions should be rinsed with cold water to remove saliva and blood. A lot of people tend to use disinfectant spray. That is fine. However, the best method to disinfect impressions is to soak the impression in a sodium hypochlorite bath for 10 minutes. If it's an alginate impression, after you soak it, make sure you wrap it in a wet gauze. Encouraging patients to spit in the spit-on is a common practice, however, it's actually not recommended. So the best method is to use the suction tips to remove any liquids from the patient's mouth. If using the spit-on is unavoidable, then make sure you clean the bowl appropriately. Care of the dental suction systems is crucial because of the potential risk of backflow due to pressure changes. So for instance, when the patient closes their mouth on the suction tip, this creates a vacuum effect and the suction fluid will actually leak into the patient's mouth. So this may transfer bacteria from the previous patient to the current patient. So to avoid cross-contamination, all suction tubes must be flushed after each patient with a cup of water. In case there is blood in the tubes, it's best to flush with a disinfectant. The suction handpiece should be wiped with a disinfectant and it should be removed frequently and sterilized. And at the end of the day, it's important to flush these suction tube water lines with a disinfectant. Testing of tap water temperature is very important, so cold water should always be below 20 and hot water should always be above 50. In the case of water contamination, a boil water notice may be issued, and in this case, this water can't be used in the dental unit or for hand washing. Always make sure to flush tap water from an infrequently used tap before use, and always, of course, disinfect the sink and the tap. All staff training records, auditing, and autoclave logs, as well as waste transfer documents should be kept for 8 years. Autoclave maintenance and validation records should be kept for 11 years. An audit cycle is a structured method used to assess and improve the quality and safety of clinical practice, so it allows us to compare what we do in practice with agreed standards and to make improvements where needed. The first step in the audit cycle is to identify an area for review, so for example, hand hygiene compliance. Next, we set clear standards and criteria according to guidelines or policies. We then measure our current practice against these standards and identify any gaps. If gaps are identified, we implement change, so this may include staff training or updating operating procedures. After that, we need to re-audit to confirm that changes have been made and they have led to improvement. So according to the Irish Dental Council guidelines, there are 4 practices that need to be audited annually. So the decontamination of instruments, healthcare risk waste management, hand hygiene compliance, and staff infection control training. All audit records must be maintained for 8 years and should be available for any inspections. And that's the end of this lecture. Thank you very much.